So we quickly realized they needed our help to support their cardiac rehab patients who were stuck at home and couldn't get that important care.
The more experience we can get doing this, the more data and discussion we can have around how effective it is and how we need to continue it beyond the pandemic.
There are pathways that can be designed for both the provider and the patient and their family about how this can continue to be sustained over time.
When it comes to cardiovascular care on the organizational level, MedAxiom understands the challenges your program is facing. Welcome to MedAxiom HeartTalk, the podcast where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
I'm Melanie Lawson, a journalist in Jacksonville, Florida, and host of MedAxiom HeartTalk. I'm excited to introduce today's topic: cardiac rehab in the COVID era. And we have three special guests today. Terri McDonald, VP of Consulting at MedAxiom. We have Terri Rogers, President of Pritikin Intensive Cardiac Rehab, and Dr. Jerry Blackwell, CEO and President of MedAxiom. Thank you all for being here.
Thank you.
Thank you.
Thanks.
We are so excited to have this conversation right now, especially during a time where there's some uncertainty, but we see the horizon coming, where we can exit all of this COVID talk and have a little bit more freedom when it comes to treating your patients. So I want to start off with a question that we ask all Heart Talk guests. What was your aha moment when you decided to begin your career in cardiovascular healthcare? Let's start with Terri McDonald.
Hi, thanks, Melanie. Yeah, so in healthcare, I think I really knew from very, very young that I was going to be a nurse. One of the earliest Halloweens I remember, I dressed up as a nurse. And so I always just expected to become a nurse. And then during nursing school, I kind of gravitated toward cardiovascular nursing and then toward critical care nursing. And it just became, it became what I did and who I really was. Taking care of cardiovascular patients is just something I've done for 3 decades now. And I enjoy it very much.
Thank you for your commitment. Terri Rogers, what about you, that aha moment?
I started my career in a pharmaceutical company called Marion Labs. And one of the products I promoted was a calcium channel blocker called Cardizem. It was one of the earlier blood pressure medicines for blood pressure and angina, which is chest pain associated with cardiovascular disease. And that's when I spent a lot of time, months and years, learning about the cardiovascular system, reading research in medical journals like the New England Journal of Medicine. And I actually got opportunities to observe different procedures such as stents, coronary bypass, back when HIPAA wasn't such a big deal. So the doctors would let me come in and observe the cardiac surgeries. So, I felt like maybe I should have gone back to med school at that time. But I stayed in the pharmaceutical industry for 15 years, always having some responsibility for cardiovascular drugs. Then I moved over to the pharmacy provider side and pharmacy benefit management side, where I ran a division of Express Scripts that serviced all the health plans across the country that insured, Medicare and Medicaid and commercially insured patients. And so always dealing in healthcare. But I really grew up with my primary focus in cardiovascular disease, more on the treatment side than on the prevention side, though.
That's life-saving work. So I can see how you can get addicted to it and want to continue that for all these years. And Jerry?
I love the practice of medicine. I love healthcare, and I love the notion of servant leadership. The clinical practice of medicine, the ability to touch folks and to help folks is what drove me to go into medicine 30 plus years ago. And interestingly, it still drives me perhaps even harder today. I believe it's a calling, and I've enjoyed every moment of it.
Such an important job. So thank you. Terri McDonald, what are some of the major benefits of cardiac rehab and the barriers that providers are facing right now?
So cardiac rehab has been a class 1 recommendation in the guidelines for several decades now. It's is very beneficial to patients in terms of reducing the risk of mortality up to 50% at 5 years after a cardiac event. And patients are much less likely, 30% less likely to be readmitted to the hospital after they have a cardiac event if they enroll and complete cardiac rehab. The barriers to cardiac rehab are kind of complex, but they're not really. Some of the barriers include cost to patients, access. You may not be close to a center. But the biggest barrier I think we see is that the lack of real enthusiasm around getting patients referred. And some of that is because of the other barriers that patients are facing that may make them less reluctant to enter cardiac rehab. So it takes a little bit of work to get a patient motivated. And there's some pretty simple fixes for that. We've actually talked about some of those in a blog series that we posted in January to the website. So you may find some helpful ideas there to overcome some of those barriers. The pandemic itself has really created extra barriers, of course, for cardiac rehab, like a lot or most of essential care, cardiovascular care. Cardiac rehab was interrupted. More than 3 million sessions at the height of the pandemic were interrupted for patients that are enrolled. And when you have a population where only 20 to 30% of the patients who are actually eligible for cardiac rehab enroll, when you have an event like the pandemic, that is, that's a super issue in terms of getting patients the care that they really need to prevent them from having future events. So it's been an added burden, and that really has continued into even now with physical distancing. The centers are not able to take as many patients as they might have previously, so it's actually creating more delays.
Yeah, and it's definitely a mindset, as things begin to open back up, and we reinforce that our facilities are safe. But I think when you look at those statistics, what you were saying about the survivability after cardiac rehab, it's like a no-brainer, but you do understand that there are things that get in the way of patients getting in there. So everyone's having to be a little creative and do some things differently. So tell us about CMS's Hospitals Without Walls initiative and what this means for HeartTalk listeners who lead these hospital-based cardiac rehab programs.
Yeah, so we had a really great opportunity. CMS in late December actually made it possible to deliver cardiac rehab virtually. It was very confusing, as most of the waivers were for providers, and it took us some time to sort it out. It was really early January, mid-January, before we finally figured out what all the waivers really meant and what was available for cardiac rehab centers. So we already knew that physician supervision could be provided virtually. So the physician requirement for supervision is that the physician be immediately available in the event there's an issue. CMS clarified that they can actually do that by FaceTime or something similar. If you can have immediate access to the physician, you're then able to have the physician supervision under the waiver. That's only as long as the waivers last. But for now, the administration has indicated that may be even through the end of this year. So programs can essentially lie the administrative structure of all the CMS requirements of their physical center over the virtual platform. So patients can actually exercise and be supervised on a virtual platform like Zoom. And you still have to do everything that you would do for your patients if they were present in the center. All the documentation, all the requirements have to be met. But as long as that physician supervision is there, you can actually hold those exercise sessions. There are some specific requirements around billing those sessions. And if you take a peek at those at the blog series, it actually kind of walks you through what those requirements are and gives you some guidance on how to get it billed.
Right. And we'll give our listeners an opportunity to learn more about the blog in just a minute. It's interesting, though, because what you're saying, it does take away some of those barriers that some of the patients were seeing, as long as they have internet connection and they can get on a computer.
That's correct.
Terri Rogers, we're going to bring you into the conversation now. For listeners who may not be aware, how is intensive cardiac rehab very different from cardiac rehab in general?
The primary difference between traditional or conventional cardiac rehab and intensive cardiac rehab is the educational content. So conventional cardiac rehab patients come in for up to 36 sessions, primarily exercise supplemented with some education. But with intensive cardiac rehab, they come in those same number of visits to the facility, but in addition to exercise, they get education. And that education comes in the form of videos and workshops. And those workshops fall into workshops around the importance of exercise, stretching, yoga, nutritional workshops, how to shop healthy, how to prepare food, how to read labels in the grocery store. And one of our more well-attended workshops are cooking workshops as well. And those all happen weekly. So those are the primary differences between traditional cardiac rehab and intensive cardiac rehab.
Yeah, it's important because that gives your patients the skills so that they can keep their heart healthy and not end up back in the doctor's office in the future. So your website states that Pritikin's virtual modality, quote, provides an opportunity to increase participation rates, enhance patient engagement, improve graduation rates, and minimize the need for this in-person facility visit during the COVID-19 crisis and beyond. And I love the word beyond because you're kind of thinking what life looks like once we get out of this pandemic state. So walk us through this. How does your platform actually work?
This is a mouthful, but we offer a cloud-based and a secure, configurable, and we call it a monitoring and patient engagement platform. And that allows the cardiac rehab provider to extend what is traditionally delivered on an outpatient basis at the hospital. It enables them to deliver those services to patients who can't attend facility-based rehab on a regular basis. It equips the provider with a mobile dashboard where they can view things like patient summary reports, alerts to changes in patients' vitals or health status, trend of views of patients' vitals, and the ability to stay connected and engaged with the patients through chat features and two-way audio-visual communications. On the patient side, they receive a provider-customized iPad. It's loaded with the platform app, and the patients can record and track daily vitals and health status. They can participate in these live and proctored workshops that I talked about a minute ago. They can view our educational videos and materials, and they can also transmit pictures or short videos to their CR team. And lastly, they can communicate secure messages to their health coach. And there's also an option for a Bluetooth-enabled device kit that can assist these patients in getting their vitals recorded through the app.
Interesting. So you're giving them a lot of the technology so that they can kind of take this in their own hands. Do you have any idea how compliance is with this new platform?
So far, so good. Our patients, according to our providers that have launched this program, our providers are pleasantly surprised by the participation rates, the enthusiasm, and the bonding that's being created through these virtual platforms.
It's interesting because they don't get that in-person interaction, but it seems that with this new virtual platform, they're getting even more interaction with their doctor and different people that will help in this process. And now we're going to bring Dr. Blackwell into the conversation. Jerry, you have more than 30 years experience in clinical practice. Have you seen firsthand how Pritikin's intensive cardiac rehab program can improve patient outcomes?
Absolutely have. As you said, I've been doing this a long time and been involved with cardiac rehab for that entire time. And I've seen the notion of cardiac rehab evolve over that period of time, but it's been very slowly. And it really has picked up at a crescendo pace with the involvement of Pritikin and intensive cardiac rehab in general. And it's really, I think, fairly straightforward what's happened. Historically, cardiac rehab has been all about exercise and being sure that folks are physically able to return to at or near their former state. We now realize that particularly with the adjustments, or should I say the advancements in intensive cardiac rehab, that's much more about therapeutic lifestyle changes. So I've seen that affect patients in a very, very positive way.
Very good. I love the optimism. So this is a great place to pause for a short message for the MedAxiom community. Heart Talk listeners, stay right with us. We'll be back after the break. CV Transforum Spring 21 Virtual will unite cardiovascular thought leaders from April 15th through the 17th. Explore the agenda and also register at medaxiom.com/CV Transforum. Come engage in a number of general sessions on today's top of mind issues, intimate breakout sessions that take a deep dive into cardiovascular challenges, and pod sessions designed to share best practices with peers from the comfort of your home or office. You can also connect with Pritikin and other MedAxiom industry partners delivering innovative cardiac rehab solutions. Again, visit medaxiom.com/CV Transforum to register. Welcome back, everyone. Before the break, we talked about the importance of cardiac rehab, also what Pritikin is doing in a virtual space. And this happens so fast for all of us. How did you pivot to your virtual platform? I want to address this or send this to Terri Rogers, really taking a deeper dive and how you made those quick decisions to be able to address the needs of your patients.
Yeah, I'm going to take us back in time to March of last year when the pandemic hit. Almost all of our licensed intensive cardiac rehab providers suspended their operations due to COVID. So they were shut down. They redeployed their human resources into other areas of the hospital that were more urgent. So we quickly realized they needed our help to support their cardiac rehab patients who were stuck at home and couldn't get that important care. So as a start, we stood up our patient resource center that allowed providers to offer our educational content to the patients while they were at home. Of course, they couldn't bill for that, but it was a way to keep the patients engaged and learning and hopefully participating in their cardiac rehab. Mm-hmm. Also, we didn't know how long the pandemic would last, and we were hopeful at that time, back in March and April, that CMS would put in place reimbursement for virtual cardiac rehab. And as you heard from Terri, they eventually did early this year. So in May of last year, we began assessing the market for a technology platform to offer a virtual intensive cardiac rehab solution that would not only educate patients, but it would allow the providers to monitor, communicate, and engage with patients at their homes. And by August, we had selected the platform based on criteria that we felt were important to providers and to the patients. And those criteria, some of which included, we wanted a platform and a company that had worked with a lot of large hospitals and physician groups, had a big client base, and they had experience in remote monitoring services for cardiac patient populations as well as other patient populations. And we wanted a platform that was, the word's configurable, you might call it customizable. So could it be customized or white labeled for each one of our hospital clients? And then it had to be easy to use for the cardiac rehab patient population. On average, there are more senior populations. Some are not that tech savvy. So it had to be a very easy platform for both the patients, but also friendly for the CR staff to use as well. Mm-hmm. And then this is more on the technical side, but when you work with hospitals and when you work with physician groups, you have to be able to clear IT and HIPAA security hurdles. Sometimes that is the long pole in the tent before a provider can stand up a virtual cardiac rehab program. Mm-hmm. So we were looking someone that had passed that test numerous times. And then the last criteria was we wanted a platform that could eventually be integrated with the hospital's electronic medical records, because many times they'll want to integrate a program as it scales into their EMR to make it more efficient for them as well. And so that's the process we went through to select our platform that eventually we started promoting in October of last year.
Wow. I mean, you think about all that you did in such a short time frame. The pivoting on that was perfect. And it sounds like you're looking long-term, how that can be implemented and integrated into future operations as well. So Jerry, it's clear from our conversation today that your team is dedicated to not only optimizing care, but true care transformation. So how does intensive cardiac rehab and the Pritikin program advance the way care is delivered?
Yeah, that's really a great question, Melanie. Thanks. There are many ways that the Pritikin program and intensive cardiac rehab generally change the way care is delivered. Again, the most important aspect is that of therapeutic lifestyle changes. So what it does, again, not just about exercise, but about diet and about changes in your mindset and your approach, is that it involves the patient in their own care. So historically in medicine, there has been episodic care. It's been all about an acute event. The patient has a problem. They come to the provider looking for a solution, and then the cycle is played out over and over. But what the intensive cardiac rehab focuses on, though, is involving the patient in their own care. And so that's transformative in and of itself. The other part of it is, and I think this is just a brilliant modification of what we normally do, and that is the Pritikin program really reinforces the notion that it's not just the patient. Now, obviously, that's the key person, and that's how the program gets initiated. But the Pritikin program involves the entire family in these lifestyle changes. So they really encourage the family to become part of the solution. And that makes it a bit more sustainable, as I had mentioned before. And so it's transformative in that it involves the patient in their care, it involves the family in their care, and it causes folks to readjust how they look at the problem that they're dealing with, not just as it's a specific episode. You look for a solution, you get it, and then again, replay the cycle. So it really changed that. In addition, there are pathways that can be designed for both the provider and the patient and their family about how this can continue to be sustained over time.
Yeah, it's inspiring. And when you bring in the whole village, that's when you see that true success, because everybody's buying in. That's great. That's so great for our patients. So Terri McDonald, let me ask, what can CV programs do right now to take advantage of public health emergency temporary waivers that are available this year?
Yeah, again, this is our opportunity. This is really the first indication we've had that CMS has an inclination to cover virtual cardiac rehab, which is something we desperately need because of some of the access issues that we talked about earlier. So what you can do is take a look at the blog series. It will give you some very basic steps about how to set up your program. And look at your patient population to see who are some good candidates, who might be really great candidates for virtual care. Do a pilot. Some programs may be a little concerned about the billing aspect of it. You can start slowly and bill just a few patients, over a few months and see how you do. But I do encourage programs to take advantage of it, because the more experience we can get doing this, the more data and discussion we can have around how effective it is and how we need to continue it beyond the pandemic.
Very important, kind of weeding out what works and what doesn't.
Right.
But we have to have participation in order to be able to determine that. Exactly. So we talked a lot about your blog series that seems like it has a lot of great information on it for our listeners today. So we certainly can't cover everything in this podcast, but for listeners who do want to learn more, and it's on MedAxiom's website, what else do you cover there, and where can listeners find it?
Yeah, so the initial blog really started prior to the pandemic, and it goes into some depth about all of the barriers that we experience. Cost is a big one. It gives some ideas around how to set up programs for patients who may not be able to cover the cost of a copay if they have a copay, and involving your patient financial services on the front end and making that a respectful and discreet process for your patients is a great option. And then the access issue, we've talked about access with the virtual platform now during COVID, but also then looking at what your patient demographics are. Do you have patients who are working that need to exercise early or late? Should you modify your hours? Should you give those patients preferential spots in the morning or in the evening? But the one thing I'd like to really emphasize that you can do as a program is focus a lot of attention on how important cardiac rehab is as a class 1 recommendation. As we start to do that, understand that it's just as important as every other class 1 recommendation, like an aspirin after a heart attack. So think of cardiac rehab the same way you would blood pressure control, aspirin, diet. If a patient's referred to cardiac rehab, you can address almost every single other class 1 recommendation following a heart attack or bypass surgery. So I would really encourage you to really start to talk and socialize the idea of cardiac rehab as being a very important part of what we do in cardiovascular services.
Yeah, it completes the circle. Without it, you just don't see the same type of results.
Right.
To Terri's point, Jerry, what about clinical protocols? Tell us how MedAxiom is working with Pritikin to create clinical protocols and other outcomes-based support for intensive cardiac rehab.
Sure. The relationship between Pritikin and MedAxiom is something more than just your standard transaction between two highly accomplished businesses. This is really about a relationship. And the relationship is about changing pathways for patient care, both at the point of contact and then in the long run. And while we're changing these care pathways, and again, we want to do this in a very integrated way and in an integrated environment, we're really trying to create a situation where there is a network of folks involved in the care. Again, the patient, their family, the provider, and then a broader network of care throughout the region and, in fact, the United States. So we're trying to create together, Pritikin and MedAxiom are trying to create a care community, a network, if you will. And as part of that, one of the things that lends itself to that I think that we can do through this relationship is that we can actually even further advance the science by having specific research, methodology, protocols, and hoped for outcomes where we can say, hey, this is where the patient started, this is where they ended, and here's how we have actually both improved the length of their life, which is very important, but even more important from my point of view, improve the quality of life. So it's the notion that we're in a mutually beneficial relationship where we can leverage the power of Pritikin's science as it relates to therapeutic lifestyle changes and intensive cardiac rehab, and the MedAxiom network and our ability to socialize these things for a common good.
Yeah, it's a big goal, but it's nice to have another platform to try to execute that for sure. I mean, it literally translates into saving lives. So Terri, and Jerry, it's great talking with you all today. Thank you so much for sharing your time, your expertise today on MedAxiom HeartTalk. Next time on MedAxiom HeartTalk, administrative and leadership roles in cardiovascular care are complex, and a staffing gap can present a real problem for your organization's momentum. We talk with industry thought leader Joel Sauer, MedAxiom's EVP of Consulting, as he explains what he and his team are doing to address this very problem on the next MedAxiom HeartTalk. And thank you so much for listening. If you like the podcast, please tell your colleagues and let them know they also can subscribe to MedAxiom HeartTalk on Apple, Google, or wherever they get their podcast. If you'd like to send us a note directly or suggest a topic, email us at hearttalk at medaxiom.com.